Hello, everyone. My name is Lucretia Williams. I'm a second-year PhD student at the University of California, Irvine, studying informatics. I'm giving this presentation on behalf of my research team for our study on the analysis of distance-based mental health support for underrepresented university students. University students from Black and Latinx ethnic backgrounds who experience mental health challenges may have increasing difficulties due to stigma in their cultures and barriers navigating mental health services on campuses. Incidents of police brutality and disproportionate COVID-19 death rates in the Black and Latinx communities also elevated the psychological well-being of these students. It is often difficult for them to seek support because of the long history of mental health stigma in these communities. Because of the intense oppression that these groups have faced, it has been apparent in recent years that they will benefit the most from therapy and counseling. With Black and Latinx groups in America still feeling the long-term impact of institutional injustice, university students from these communities are looking for a safe and inclusive environment. We conducted a survey study that consisted of 36 university students, 25 which were undergraduate students, and 11 graduate students who identified as Black and Latinx and who were currently enrolled in a degree program. The survey was hosted on Qualtrics survey platform. A qualitative analysis of the short answer responses were conducted. The analysis included an inductive approach to derive codes from participants' responses, and we also identified convergent and divergent thematic patterns within the data. The Qualtrics software was also used for statistical analysis of multiple choice questions. Our study team also conducted a content analysis of 60 US college and university counseling center websites, 20 websites that were from predominantly white institutions, 20 websites that were from Hispanic serving institutions, and 20 websites that were from historically Black colleges and universities, as ranked by the US News and World Report in August of 2020. From our analysis, we created a codebook of 16 codes where 3 researchers coded the websites. The researchers identified the initial units and categories of analysis based on a combination of their collective knowledge of mental health resources and the thematic categories identified through coding the student survey responses. From our study, there were 4 emerging themes that came about. 1, improving access. 2, a holistic approach. 3, peer and community support. And 4, culturally responsive mental health options. For a first thing that we found was improving access. Out of the 60 websites that we reviewed from the content analysis, 10 websites offered scheduled counseling via phone, 5 offered counseling via video, 34 offered both, and 11 offered no remote options or were unclear in their offerings. Within the survey response, students expressed strong preferences for wanting better access to services on campus. For example, one participant identified wanting easier access to mental health professionals, referring specifically to the difficulty of actually making contact with a counselor. A second theme was a more holistic approach. Out of the 60 websites reviewed, 53 offered some form of wellness-related resources to their students, and 41 were coded as having a wellness ethos as opposed to a more traditional medical model. In our survey, student respondents requested healthy tips to deal with different types of mental health issues, and mood tracking and healthy exercises for mental health improvement, meditation, and calming practices. For our third theme of community peer support, out of the 60 websites reviewed, 26 institutions addressed the need for more community and shared experience through group counseling focused on a shared student backgrounds and identities. And this correlated with where participants asked for more peer-to-peer conversations, alumni network resources, and a community of people that are dealing with similar issues. For our last theme, culturally responsive and mental health options, out of 60 websites reviewed, 18 had no bio information on the counselors. For others, the information was often buried and difficult to find with text. There were no photos and contained minimal information that only included a name and a professional degree. Respondents wanted to have photos of nearby professionals, wanting names and number of nearby professionals with pictures. For our future research, we will be conducting interviews with counselors, students, and professors to understand motivations and preferences on specific technological solutions that would be able to help and be of resources to everyone involved with the student counseling center process. Thank you.